I mean, it should be everywhere. It should be in candy dishes, in the mall, just so that, just in case somebody wants one. It's better to have one and not need it than to need it and not have it.
Take-home fentanyl test strips work well. That's according to a new study from Vancouver Coastal Health, the BC Centre on Substance Use, the BC Centre for Disease Control, Interior Health, and the First Nations Health Authority. Researchers compared fentanyl detection rates using take-home test strips with those tested by trained staff at harm reduction sites. Among the 1,768 opioid drug samples tested, the positivity rates of the take-home strips and those examined by trained staff were both about 90%.
When people are testing opioid samples, they can get accurate results using take-home test strips, and they can rely on that information as being as accurate as they would get if a trained personnel, did it on site. And so we think that this might expand this sort of applicability, that there may be people who are not so keen at having the drugs tested on site for various reasons. And this may sort of expand who is utilizing these services.
Harm reduction advocate Guy Felicella says these test kits are literal lifesavers. But whether the general public knows how to access them is a different story.
In the downtown core, you could probably just walk into not just Vandu, but supervised consumption sites, OPSs. I mean, you could talk to an outreach worker. I mean, you could get them easily in Vancouver, but not in rural communities. There'd probably be, if one place that has it, and they probably don't advertise that they have them either.
Felicella says it's essential to communicate where kits like these can be found. He adds the stigma of asking for a kit is also a major factor, preventing many from seeking out the life-saving tests.
The majority of people who are dying of a drug overdose, 80% die alone, but over 50% of those are in private residence, and that's just a house like yours or mine.
Dr. Sukhpreet Clare hopes the study will provide policymakers and the public more understanding of the value of take-home fentanyl test strips.
The drug supply is variable, it's changing. This is one piece of harm reduction that gives people information and can potentially keep them safe, but ultimately all these things are just targeting a drug supply that is really hard to pin down, and the sort of provision of a safer supply or regulated supply is really what we need to move towards.
Ashley Burr, City News.